Okay, assalamu alaikum everyone. Thanks for joining. Sorry for a slightly delayed start. We'll just give a couple more minutes for people to join and we'll be starting shortly. Okay, assalamu alaikum everyone. I'm Dr. Zain Toukan, a GP based in London. Ramadan Mubarak to all of you, and again, thanks for joining us today on this webinar, which is about mindful medicine, understanding what's halal in your medicine this Ramadan, and it is run by HalalMed. Yeah, next. So our the speakers joining today are Sheikh Dr. Rafkat Rashid. He is a GP, a trained Muslim scholar, academic researcher, and international speaker on medical fiqh, principal Sharia advisor, also advisor in bioethics, and co-founder and academic director of Al-Balagh Academy. He'll be joining us later in the webinar. Got Esther Nabiha Butt, who's a co-founder of HalalMed, is a prescribing and practicing clinical pharmacist in the UK, and has completed Al-Balagh Academy's Fiqh of Halal and Haram prescribing and the Fiqh of medicine courses. And finally, we've got Hamdi Lebabidi, who's also a co-founder of HalalMed. He's a community pharmacist in the US and currently a medical student. He's also completed the Fiqh of Halal and Haram prescribing at Al-Balagh Academy. Next. So what we'll be covering today, so an introduction to what HalalMed is, brief fiqh overview, some misconceptions about halal and haram medications, the ingredients in certain medications, how to use the HalalMed website, and we'll end with a brief Q&A. If you've got any questions throughout the webinar, just post them in the chat. Yeah, and this webinar, as well as the Halal website, provides educational content only. The webinar does not provide specific medical advice. No medical related questions will be answered, and always make sure to consult your licensed healthcare professional regarding your medications and your own health.
All right, so just to start off, just to kind of begin the medication introduction here, we just want to have Sheikh Dr. Rafkat Rashid discuss this stuff over here.
Sorry, can you hear me?
Yes, Assalamu alaikum, Sheikh.
Yes.
Okay, yes, they can hear you.
I'm a bit late. And you just caught me right at the act as you're just entering the screen. So inshallah, I'll just talk through these slides slightly. Just bear with me a second. I'm just trying to get my head around where I am at the moment. Okay, so the fiqh of medication. So there are a number of misconceptions regarding halal and haram medication. And I suppose what we've done here is we're sort of demonstrating two extremes of that. So there is one understanding that people usually go away with, and that is this understanding that all medications or all medicines are halal because of genuine medical need. So there's an assumption that because ill health is clearly a major factor, and some people even use the understanding that, you know, one of the higher objectives of the Sharia is to maintain good health. Yeah. So on the basis of that, medication is a good thing. So it's something that relieves our symptoms. It's something that will treat us, cure us. And so then we can go and perform our salah and all the different types of ibadat, our acts of worship. And hence they see it as a slogan statement that all medication is halal. And even though it's not logically thought of this way, most people just overlook it. And a lot of it tends to be based on ignorance, in fact. What tends to happen is, generally speaking, people just consider medicine is medicine, and, you know, we don't really need to go into the details of what are the ingredients, probably because they're minuscule, etc. So this is neglecting a very, very important part of our Islamic tradition, which has grown over 1400 years. That is that the fuqaha, the Muslim scholars, have talked intensively about the concept. In fact, they even termed it as tadawi bil muharram, as treating yourself with that medication or the kinds of medication that are considered as prohibited by default in the Sharia. So that's one form of misunderstanding that tends to occur. But rather, we need to realize that our tradition is clearly stipulating a number of conditions that we must adhere to when we think about, number one, prescribing medication, if we are clinicians or physicians, because there is a sense of accountability in doing that. And number two, as patients, that we are taking and consuming medication that is halal. And if that medication is not halal, we fulfill the conditions that that Islam excuses in our situation, so that we can take that particular medication. So if you go to the next slide, the other misconception. Okay, so the other misconception is that medication should be avoided because of widespread haram ingredient use. Now, that can be attached to a number of different reasons. It could be conspiracy theories, and there could be all sorts of ideas about, you know, certain vaccines, they contain haram ingredients. They contain sort of monkey cells and various other interesting things that are, you know, going around in social media. And for that reason, we put a blanket statement out there that any kind of medication should be avoided. Yes, you know, in terms of the health profile and side effects and adverse effects, we do need to take that into consideration. And even in Islam, we take that into consideration as well. La dara wa la dirar. Do not harm, do not reciprocate harm. This is an important maxim, a qaida fiqhiyya in Islam, whereby you avoid medication that causes harm. But in Islam, harm is of two types. Harm is not only of a physical type, which is physiological, it can harm you in terms of the ingredients that you're consuming, but also from a spiritual perspective, which is not physical, it's spiritual. And that is medication that Allah has made haram. حُرِمَتْ عَلَيْكُمْ مَيْتَةُ وَدَمُّ وَلَحْمَ الْخِنْزِيرِ. Allah has made haram upon you a number of different things. Yeah, khamar is made haram upon you. The meat of the swine. He's made haram upon you. Carrion, dead meat, and various other things. So these things are very clearly stipulated in the Quran. Now, we need to understand the nuances of how that links in with the use of medication that we use on a day-to-day basis. So even though something may have initially started off as being haram, i.e. the ingredient is haram, it could be that there's a possibility it may have gone under a form of transformation, which we call istihala, where the form has changed to that level that the Sharia would consider as a changed product. And for that reason, it becomes halal. Or it may be for other reasons. It may be that it's just part of the process. So there may be some kind of contaminants within the process of manufacture. And as a result of this, the final product has been purified to the degree that those excipients or those ingredients no longer remain. So in that situation, that would also be considered as halal. So, you know, it's a nuanced discussion We can't just say that just because there is a mention of even animal ingredients in particular medication, that we can clearly state it is haram. So that's one particular aspect of it. The other is that we don't just go by this idea that all medication should be avoided, because there is a possibility that, you know, drug companies, we can't trust them, and therefore they're probably putting in haram ingredients specifically just to harm the Muslims. So these are ideas that sometimes do go around. And sometimes I do see Muslims who become quite practicing Muslims, and they become quite stringent in their rulings with the lack of understanding of the depth of really the reality of the situation of, you know, the product, the production process of how medications are made, and also how they are manufactured, packaged, and also, you know, stored, and various things like that. So it's much more than that, and that's why there's an important need for, you know, clinicians, pharmacists, and people like this to come together and really start looking in detail about what the Sharia is stipulating, and what is the process that medication is undergoing, even in terms of the final product, in the processing, not just necessarily in the development of the medication in terms of the ingredients, but rather in the processing of medication, whether there are any contaminants. And hence we have HalalMed, alhamdulillah, that is working in this particular area. Okay, inshallah. Next slide, I think. Okay, so yeah, so this is addressing some of those particular concerns. So I'm just going to briefly outline this, recognizing limited time, and then we'll talk a bit about this in more detail later on. So there are two common things that Muslims identify in particular when it comes to medication. One of them is alcohol. So there is an understanding that anything where the word alcohol is mentioned is therefore haram, because Allah has made alcohol haram. Yeah, and people actually use and say it in that particular way, that alcohol is haram. So one thing that we need to recognize is alcohol is a chemical structure, is with a OH group. And that's about it. So anything that has that particular chemical structure will be considered as an alcohol. And there are many, many different types of alcohol. Whereas Allah subhanahu wa ta'ala makes reference to khamr in the Quran. And this is a very important thing to understand. Khamr is a term that is used for an intoxicating beverage that is considered as prohibited in Islam, even though it be of a small quantity. So even even if it's small. So in that sense, it's very, very important to understand, is alcohol synonymous with khamr? And the answer is a clear no. Alcohol is not synonymous with khamr. Therefore, we need to understand what we mean by khamr from the Sharia perspective, not from a science perspective, from a Sharia perspective. So from the Sharia perspective is clearly indicating a beverage that intoxicates you. So if a beverage has the potential to intoxicate you, then even a small amount of that beverage is considered as prohibited. And that's the important thing to understand from this. Now, you have different schools of thought. You know, I'm talking about the Sunni schools. So you have the Hanafi, you have the Maliki, you have the Shafi'i, and you have the Hanbali, who are slightly different perspectives on the stringency of what they would consider khamr. So they use the word muskir. And muskir means anything that intoxicates. So that can even be a solid. So, for example, even taking certain drugs are muskir. So muskir actually means to intoxicate. But when it comes to a beverage in particular, and according to the Hanafi school, the understanding is that a beverage that derives or is derived from, in particular, the ashraba arba, and that is, you know, that's dates and raisins and grapes. Those produce that are originally considered and were produced as wine. So the scholars extend this discussion, and they say that that also includes the concept of muskir. So any kind of beverage that is intoxicating would be considered as khamr and hence prohibited. I'm not going to go into the details of the depth of discussion. You can go onto the website and there's a lot of detail there regarding this. But the main point to take from this is the importance of recognizing that not all alcohol is khamr, and that's the important thing. Gelatin, again, gelatin is basically a protein that comes from collagen. And collagen can be derived from skin, from bone, from different parts of animals. And that's the important thing that we need to recognize here, that it can also be produced from vegetarian sources like plants and various things like that as well. So we need to differentiate what kind of gelatin we're talking about here. The next thing is there is a minority opinion that the production of gelatin goes through a process of istihala, which is a transformation, and hence the final product becomes halal. The majority opinion is that that's not the case. It still maintains its original form, which is animal-based, and hence for that reason it'll be prohibited. So we need to understand the concept of gelatin in more detail, understanding of the source of gelatin, where it's derived from, and also what particular position you hold in terms of whether transformation has occurred or not. So in essence, medicines are always halal because we need them, and this is the understanding that's out there. And in fact, I would say that a lot of that is usually due to a concerted voluntary understanding of avoiding the question of whether a medication contains haram ingredients, because it's too challenging for us, to be able to deal with the issue head on. And for that reason, a lot of people, I know a lot of Muslim clinicians, they don't even contemplate even the discussion of halal and haram medication. They just prescribe it because that's what we're supposed to do. That's not for me to be concerned with. That's more, the patient can, patient choice, they can make that decision. But there is a sense of accountability on the physician as well who is prescribing. Okay, so hopefully that sort of briefly outlines the important things about common ideas among Muslims that exist regarding these two particular ingredients. Okay, inshallah.
Yeah, so here we transition to HalalMed. Like Dr. Nafaqat said, sometimes it can be challenging for Muslims to ascertain if ingredients, particularly like problematic ingredients, are in medications. So this is why HalalMed was created. We were founded last year. We were a group of pharmacists and clinicians where we regularly encountered questions in our patient care encounters from patients who were requesting or asking if their medications have halal and haram ingredients. And we found that there was not a consistent, centralized source of medication information about this topic in particular. So with HalalMed, we aim to address this gap in accessible, reliable educational resources around halal and haram medicines. So we want to make this website a clear and trustworthy website to allow both all healthcare professionals, as well as Muslim patients to be able to determine if their medicines are halal or not. Next slide. So why this webinar? So, as everyone knows, we're in Ramadan currently. It's a time of reflection and realigning ourselves with Islam. Time to see if our daily lives, including our healthcare, our medications that we take, are really in line with what Islam teaches in terms of the fiqh of medication and everything. So we all want to try to better ourselves. So this webinar is to kind of introduce HalalMed to the public and raise awareness about this nonprofit organization. Next slide, please. And then I think Nabiha was going to discuss the UK.
Yeah, so in the UK, if you're a healthcare professional, you might already be aware of the Electronic Medicines Compendium, where you can access information about licensed medicines in the UK. And also, if you're a patient as well, there's also leaflets on there. So just to break it down, there is a section in where to find this information about medicine components can be found in section 6.1 for the list of excipients. And it also gives you like a breakdown of what excipients are in the medicines in that section. And there's also section 2 as well. So it tells you what the medicine contains and how much of each active ingredient is in it. So also has information on production processes as well of the active substance, such as, for example, whether it's manufactured using Chinese hamster ovary cell lines, and that will be discussed later in the webinar as well.
And then just regarding the United States, our central database is going to be HalalMed. It's a kind of centralized database of all the package inserts or detailed documents provided by the Food and Drug Administration regarding individual manufacturer-specific medications. So in section 11, consistently across the board, we're going to have whatever ingredients are there, as well as the production methods. And we'll go into detail as to the difference between the ingredients in medications versus the production methods, both of which are relevant from a fiqh perspective. But section 11 is going to be where you find information on that. Next slide. So I just want to discuss this algorithm that was conceptualized actually by myself and published recently in the below link on the slide. This was inspired by an Islamic bioethical framework as to how to cater to Muslim preferences regarding halal and haram medication, while also bearing in mind the goal to mitigate as much changes or modification to treatment plans as possible. So what aspect of the treatment plan do you modify first? Which one do you consider modifying first? And if that doesn't work, which one is next, etc. So if you have a patient who wants to know if their medication regimen contains halal or haram ingredients, the first thing you should consider is to modify the manufacturer of the medication. And the reason that is that it preserves things like the medication itself, but also the dosage form, the method of administration, and things like that, and other aspects of the medication. So just as an example, if you have a patient with an albuterol inhaler, albuterol is also referred to as salbutamol outside the US. Frequently, albuterol actually contains alcohol, not just any alcohol, but ethyl alcohol in it as a stabilizer or whatever else they use it for, only in particular manufacturers. In other manufacturers, it's absent. So in my practice, I would go to the website I referred to before, HalalMed, and investigate the different manufacturers I have in my pharmacy of the albuterol and see which ones have versus which ones don't have alcohol. And in reality, some do have and some don't. So we can modify that. The advantage of this is that we don't need to consult, as pharmacists, we don't need to consult the physician or the prescriber regarding this modification, which can be very convenient for the patient. But if that's not feasible, then the next step would be to modify the dosage form. So that would be things like tablets versus capsules, liquids, things like that. So as another example, if you have a patient who was prescribed Keflex or cephalexin capsules, many of us know that capsules contain gelatin. The capsule shell that has the medication contains gelatin. Cephalexin is available in both capsules and tablets. And so what you can do as a pharmacist or as a physician, you can modify the treatment from a capsule to a tablet. So that there is a bit more of a modification there than the first step of this algorithm. And then the other disadvantage of this step is that usually, at least in the United States, you would have to consult the physician before that modification is made. So the third step, if that doesn't work, would be either one, depending on the clinical context, to modify either the method of administration or the medication. So modifying the method of administration would include things like, let's say you have a capsule for a patient and there's no tablet available. It's only in the capsule. you would use your clinical judgment, look up various drug information sources to see if it's okay to open the capsule and empty that powder of the medication into things like liquids or applesauce. And that's obviously, as healthcare professionals, we know that that may be appropriate in some situations, but not appropriate in others. So it should be advised and really strongly emphasized to patients that do not do this unless a healthcare professional has been consulted. And then if that doesn't work, then a medication modification is warranted here as well. So things like switching from one class of medication, from one medication in a particular pharmacologic class to another. And I should emphasize here that this algorithm is really meant for healthcare professionals to apply to their clinical practice, to both their prescribing and dispensing practices, and not really for patients to apply on their own. This is something, if you're a patient watching, then I would encourage you to share this article with your healthcare professionals. They can apply this and, according to their clinical judgment, decide any treatment plans, any modifications to treatment plans that you may need. And this is because we don't, at HalalMed, we don't want to, make patients like modify their treatments and take their medications unsafely. It really has to be under the direction and supervision of healthcare professionals. All right, next slide.
Okay, so just before we move on to the next part, we just have a short quiz just to test your knowledge. So if you can put your answer in the chat with a reason if you can, and then I'll move on to the next slide. So what does everyone think? You find out medicine contains the following, and what excipient would you think might not be halal potentially in the list? Is everyone able to comment in the chat? Okay, so we've got C as one. Any others? Okay, so we'll just move on. So it's actually polysorbate 20, which is an excipient in medicines. Most of it is plant-derived or synthetic nowadays, but it can potentially be derived in some cases from beef tallow. The benzyl alcohol and the propyl alcohol are synthetic, so they're not the same as ethanol. They're synthetic alcohols, so they're considered halal. There's also pre-gelatinized starch. So this is one that people might think when you look at it, oh, it might have gelatin. It mentions it in the excipient, but it's not the same thing. It's actually a multifunctional excipient, so it helps give tablets the right shape and strength also.
So for this slide, we want to make it kind of like an interactive slide. We see here a number of questionable ingredients. Some of you may be aware of them, maybe not so much of others. So kind of just going off the list. So if you want to post in the comment section, what does everyone think of gelatin? Halal, haram, and under what context? So I don't see any comment now, but so I can briefly discuss gelatin. And maybe Dr. Rafaqat can elaborate, but according to most schools of thought, it is actually haram if it's derived from pork. It has not gone an adequate transformation in its manufacture from pork collagen. And it's routinely found in things like capsules, but also in things like in some tablets, actually. A number of tablets do contain gelatin in them, and it's found in a number of vaccines, I think. And so it is kind of a widespread ingredient that's found. And then heparin, who knows about heparin? Any thoughts on that? So heparin is actually, healthcare professionals would know, but to any patient, it's used routinely in the hospital to prevent or treat blood clots in the vein, in veins in the leg and the lung and things like that. So I have a comment here. It says all heparins are pork-based. That is true in the United States. I don't think that's true in the United Kingdom. I don't know if maybe how others can correct me, but I do believe that in the UK there are beef heparin, bovine heparin products available. In the United States, they're all pork-based. And that was not the case, I think, prior to maybe 2008, maybe 2009, when all the bovine heparin products were pulled from the market. And heparin is not just a medicine, it's actually found as an excipient in some medications. So for example, there's a product called 4-factor PCC used in the hospital, which uses heparin as like kind of in small quantities to kind of prevent coagulation of the product itself. So we need to be diligent in investigating whether that's found in our medications. All right, so ethanol, any thoughts on ethanol? Yep, yeah, it's a type of alcohol. It's actually the alcohol that's relevant from a fiqh perspective. Like I said before in the previous example, it's found in some inhalers. It's also found in some other products as well. Again, we don't want to confuse this with things like benzyl alcohol or propyl alcohol that have nothing to do with the relevant alcohol from a fiqh perspective. There's also nuance with this. It's not necessarily haram. It depends on the source of the alcohol and also the percentage of the alcohol. So if it's synthetic, for example, it may be like less problematic than things like that are like grape-based, for example. Okay, what about magnesium stearate? Yeah, it can be derived from animal lard. Comment here. I would say, from what I've seen, most of them are plant derived. From like the literature that I looked at. But yeah, there is a possibility of being derived from animal sources. And it's found in things like tablets and a number of other medication dosage forms as well. Polysorbate 20, maybe we can skip that because we just discussed it. And then plasma-derived products. So this doesn't just refer to things like blood products for transfusion, but also things like IVIG, for example, IV intravenous immunoglobulin, which is used to provide some passive immunity to patients with like immunocompromise. What they do is they take the immunoglobulins from a number of plasma samples, kind of pull them together, and then extract the antibodies from them. And so this is also plasma derived. It falls under that category from a fiqh perspective, and so that has to be kept in mind when making sure that medication regimens are halal. So this I alluded to earlier, the production methods of medications, the right side of the right part of the slide, particular cell lines. So we have Chinese hamster ovary cell line, we have the Vero cell line, and we have the MRC5 cell line. These are cell lines are basically a method to produce a medication. They're not found in the medication, but they are part of the production process. So before I comment on those, if anyone wants to, if they have any knowledge about them, let us know in the chat. So I guess I can discuss them. So the first one, the Chinese hamster ovary cell line, it is actually ubiquitous to produce many proteins, to produce many, some vaccines actually. And an example of that would be a medication called adalimumab, brand name would be Humira in the United States. That's actually produced via this cell line. And we have a whole discussion on this on our HalalMed website that you guys may be interested in seeing. The Vero cell line, it comes from an animal source as well. And one of the vaccines that uses this cell line is the inactivated polio vaccine in the United States. And then lastly, the MRC5 cell line is from a human source, a human cell line. And so in the United States, one example would be the rabies vaccine, and also the hepatitis A vaccine uses this cell line for production. So I don't know if Dr. Rafaqat has any comments, but if not, then we can move to the next slide.
I was hoping that if there's any questions, we could address them regarding some of the ingredients and excipients mentioned here, and as well as the cell lines. Just a general overview regarding cell lines. It's quite important to recognize that just because something is produced from a particular cell line, be it Chinese hamster ovary cells, etc., that there is some difference of opinion, in particular with the Hanafi position relative to the other three schools. And that is the opinion regarding the concept of transformation again, whether there's been a form of istihala through the process of producing the product that is required, or the protein that's required as part of the final product in the vaccine or whatever this is being used. So from that particular perspective, the Hanafi position, if you go into the depths of the fiqh books there, they do talk about the idea of there being some level of istihala, in other words, some level of transformation. And for that reason, those products will be considered as halal and permissible anyway. That isn't necessarily the position with some of the other schools. However, there are other nuances that need to be attached to some of the other schools in terms of how they see the product, because at the end, the end product may have gone through a purification process where there are no remnants of the original cell line in there. And that's an important point to take. So just because something's been produced from a particular cell line, there's two questions that arise. One is the process, whether that goes through a qualified transformation to produce something which is pure. The Hanafi position is quite liberal on that. And the other point is regarding whether there are any remnants of the cell line product within the final product. So those are probably the important things to note regarding that. But I've written an article on this for anybody who's really interested in the depth of that discussion that you can access, inshallah, on the HalalMed website.
Okay, so what action can you take? So you've got your medicine, you've looked at the resources, you found out what the excipients are. So you can start using HalalMed's checklist and checker tool. And this is where you can see what your medicine contains as well. And also it flags up potentially the excipients that you might want to look into as well. We also have developed a classification tool So we have classified ingredients and excipients according to halal status within medicines. And we've got many educational guides as well on the website. So do read through them. Some of you might have already had a look at them. Patients also will find it helpful to also refer their healthcare professional to HalalMed for general information as well, that you can find on there. So this is just a summary of the classification system at HalalMed. So we use a simple color-coded system to help patients and healthcare professionals quickly understand the permissibility status of medicines from a halal perspective. So I'm just going to go through each one briefly. So green will mean that there's no impermissible ingredients and excipients, and there's nothing of concern, such as animal-derived excipients, for example. So these are considered halal. And yellow, likely halal. The yellow indicates the product is likely halal based on the majority scholarly view. However, there might be minority opinions that also differ. So the category encourages awareness, but not necessarily avoidance. And doubtful amber. So this is if there's potentially you might be contacting companies if there's not enough detail to make a halal assessment, or there's a significant scholarly disagreement about an ingredient's permissibility. It signals sort of a need for personal judgment as well, or further inquiry. And red is reserved for products that are universally considered not permissible, or other substances that are clearly identified as haram as well. However, and this is important, that just because a medicine is classified as red, it doesn't mean that you can't take it. It doesn't mean that patient can't take it. It only means that the medicine is impermissible by default, so that certain conditions permit the use of the medicine. And HalalMed discusses also these conditions in further depth as well. And if you like to stick to a particular school of thought, you can investigate as well what that has to say about particular ingredients as well. Because when we classify a medicine, we also detail what led to that classification as well. And we also discuss the different perspectives on that. So ultimately, the system is designed to, support informed decision making, and also encourages patients as well to speak to their healthcare professionals about their medicines, and also seek clarity on that.
Okay, thanks, Nabiha Hamdi and Sheikh Rafka. There are a couple of questions from earlier. Hope everyone's found that useful, inshallah, gained some useful knowledge. So one of the comments or questions was, would it not be better to start by posting the most widely used medications and putting that on the HalalMed website, and then moving into the further specific information and intricacies?
We do have a list of medicines that are currently on there at the moment. In terms of widely used, I think it would, in terms of putting information on there, we would need, we wouldn't be able to post anything, but we can signpost, particularly as there's sort of company-specific information on there. And also, medicines also have different ingredients as well. And the medicines, we wouldn't, it's not necessarily that we are listing medicines, because all of the medicines, even if they're widely used, might have different ingredients as well. So it's important to look into that. But you can, if you want to add anything, Hamdi and Dr. Farkas, about that.
Yeah, I think the question is stated with the assumption that we can easily access the detail of the ingredients and the excipients of every kind of medication. Number one. Number two, that the manufacturer has given us the license and the permission to be able to display those ingredients on our website. So we've had some immense obstacles in both those areas, because sometimes what you do is when you ask for ingredients and excipients within a particular medication, the manufacturers can be quite brief in their response, or they may even say we don't know. For example, contamination, or they will give you a certain level of information, and they'll miss out some of the vital amounts of information, like, for example, the concentration of ethanol, for example. So it's not as straightforward as labeling and putting up, all the common medication, but rather it's more a point of what kind of medication we have the information for, and also the medication that we can actually put that level of detail on the website with the consent of the manufacturer. Those are some of the obstacles that we have, and hence the importance of this particular webinar to get the Muslim public asking these questions from these manufacturers, so important, so that the manufacturers already recognize that, hang on, there is something going on here where Muslims are really making those inquisitive questions and putting them to us, and we need to get our facts right. If that's not been happening to the level that it should be, and for that reason, there's a serious amount of complacency, which to me, even from my understanding, is quite surprising in the manufacture of medication. And we need to really, really address that. We were just looking at some of the figures in terms of the kind of browsers on our website, and interesting enough, the highest is UK, which is probably expected because we're sort of UK based. Then the USA, which is another expectation because we have quite a lot of links with the USA, with Hamdi, etc. And then the third is China, and that's really interesting. So you're looking into that, which suggests that there are manufacturers and other people other than patients and clinicians who have a real interest of the information that we're putting on our websites, in particular because it's coming from China. We know that China produces a lot of the sort of ingredients for some of these drugs. So it's really interesting to know that manufacturers are probably out there looking for this information, what is halal and haram, and they're going to HalalMed websites or other similar kind of websites. And that's a really important point to make, which means that it's very, very important as patients, as clinicians, as Muslims, anybody from the Muslim community, or anybody other than the Muslim community, that we ask those really, really important questions. And you can navigate the kind of questions that you need to ask regarding certain ingredients and excipients by going onto our website and looking at what you need to ask. That's why the website's there. It's there for your personal information. So inshallah, do use it, and that's how you're going to really benefit, not only yourself, but also the Muslim Ummah, in ensuring that the medication that we're taking is halal, and the manufacturers are not complacent in what they're doing in terms of when they're producing these particular drugs.
Yeah, and also, like, patients often ask very specific, understandable questions as well about ingredients, source of gelatin, origin, concentration of ethanol in the final product, whether lactose has been manufactured using animal-derived Rene as well. And much of this information isn't always readily available in the public domain, such as in the summary of product characteristics known as SPC, patient information leaflets called PIL. So for those of you that don't know, SPC is a detailed document written for healthcare professionals. It includes information about how the medicine works, dosing, side effects, and also the list of ingredients and excipients, both active and inactive as well. And the patient information leaflet's basically the leaflet that you get inside the medicine box, and that also has the ingredients and excipients. And both are documents approved and regulated in the UK by MHRA to ensure that medicines are safely and correctly used. However, while they list ingredients, they don't always have the detailed information that is required to determine halal status, such as, whether gelatin is bovine or porcine, or, the origin of certain excipients. And when that happens, usually my approach in practice is to contact the company directly, request clarification, and then I follow up with the patient once I receive an official response, so that I'm giving up-to-date, accurate information. And in my experience, companies do aim to provide accurate information. They operate within the regulatory frameworks overseen by MHRA. However, responses can sometimes take time. And, in a busy pharmacy or general practice environment where we might be supporting many patients simultaneously, that delay can make it also quite challenging as well to provide immediate reassurance. So it's actually about recognizing that frontline clinicians, we need access to timely access to the detailed excipient information as well, to help support shared decision making. And this is exactly one of the reasons why we set up HalalMed, to bridge this information gap. And as Sheikh Dr. Farkad was saying, we provide structured question templates that patients or clinicians can use when contacting the companies as well. And it helps to make sure that queries are clear, consistent, and specific as well, like asking directly about the source, ethanol derivation, and also final concentration as well. So we're all sharing the same goal. We're supporting patient confidence, transparency, and safe prescribing within existing regulatory framework. So, the more streamlined and accessible the information becomes, the easier it is for us as well to serve our patients effectively as healthcare professionals as well.
Can I just add one last point before I go, because I need to go. I have a lesson. So I'm just going to make an appeal for somebody who's working with HalalMed, and the pharmacists that have worked really heavily, intensively over the last number of months, trying to get a lot of this information up there. Now, I've been doing this research for some time, so it's something that I've been producing generally anyway. But they've put a lot of effort trying to contact manufacturers, meeting up with the manufacturers. The amount of work that's been going on behind the scenes is no way justified from the information that's been put on the website. The amount of work has been immense, and it's through voluntary time. So this is clinicians who are basically spending their own personal time trying to get this information for you. So it's really, really important that if we want to take this to the next level, where we can even, to some degree, challenge, manufacturers, and even produce much more detailed information, as a general statement, the more you go into this, you're opening up a can of worms. The more you realize the depth, the detail, and some of the information not being given, which we really need. So it's really important for us to be able to get that level of information. The only way we're going to be able to do that is if we get the financial support from our community. We're an independent body. We want to remain independent. And the only way we can remain independent is when we get some financial support from the Muslim community. There's a link here. This is a Ramadan. It's a month of mercy. Please try to donate as much as you can for this really, really important cause, because this cause is about Muslim people or Muslim patients taking medication which is halal or haram. That's a huge thing in Islam. Yeah. So to be part of that process, this is an immense sadaqah jariyah. So I would highly recommend that. Don't take this as a minor thing. It's a huge thing. And for it to really work and for us to take it to the next level, there's a real need for our Muslim community to support us in this. And you can do this through two ways. One is financially supporting us, and more importantly, make plenty of dua, plenty of supplication for us, that there is immense success in the work that we're doing and in anybody else who's involved in this area. Jazakumullah khair.
Okay, so as that's ending, so thank you all for joining us, Sheikh, and I will reiterate what Sheikh Rafkat has said, is that there's been a lot of effort into HalalMed. It is a resource that is for us, for our communities, for us to be more aware of what is in medications, for us to make the informed decision, and as well as clinicians, so as a GP, I think it's definitely a resource I will be accessing to support my patients as well, and to empower my patients to make a fully informed decision. It's time for today, but if you've got any queries, then we do encourage you to send questions to the HalalMed team, access the website, support also there via newsletters to subscribe for the updates, and support via the launch good as well. So make a donation. Any little would help in this ongoing work. Okay. So again, thanks for joining us. Ramadan Mubarak to you all, and inshallah you have a blessed rest of your month.